Have you ever wondered who the nurse to the nurses might be? Hi, my name is Tammy, and today I'm going to talk about what a nurse informaticist is, what her scope of practice is, and how she affects master's prepared nurses. So I had the privilege of interviewing a nurse informaticist at my place of work. Her name is Anina Kolikath. And she goes by the title of Clinical Nurse Informatics Specialist. They go by many different names. Could be Nursing Informatics Specialist, Nurse Analytic Analyst, or Clinical Analyst, Clinical Informatics Specialist. They have a variety of names, but hers is Clinical Informatics Nurse Specialist. So she has a really intriguing story. She came over to America already a nurse. She came from India, and around 2009, she realized that the way to go would be to get more education. So she went into a multitude of specialties. She got her MBA in strategic planning. She also got a master's in sociology and a master's in informatics, which really played well into her career because in 2009, President Bush decided to incentivize all the facilities, all the hospitals to go electronic, to bring technology to the workplace in healthcare. So she found her talents of very good use. This lady that I interviewed, she's spectacular. So she taught me what my resources are as a nurse. And she's a hub of resources because her day-to-day includes two teams underneath her. She's in education and she's also in informatics. Let's talk about what she does as an informatics specialist because they kind of go hand in hand. So as an informatics specialist, she has a team that she works with. One includes a pharmacist, another includes the CNO for the nurses, and then a physician as well. And they go through and those leaders have a field members who report to them efficiencies or non-efficiencies of the electronic healthcare record. And then they also report to them other technologies in the hospital that can use some updating. So they're constantly researching along with Anina Kolikath. And she is to organize, collaborate, and communicate with all the team members on how to best serve the facility using technology. But she doesn't stop there. She also reports data. So she brings down spreadsheets, she uses software to collect data, analyze it, find trends, and then sends that information to the appropriate place that she needs to report to, which sometimes can be the government. For instance, COVID. She needed to report the number of ventilators being used, how many people were dying, how many rooms were being used, how many were COVID, non-COVID, all of this information. So she's affecting her team, her hospital, and then also the entire United States. She is the nurse to the nurses. She is our extended arms, which I really had no clue before. So as a nurse informaticist, that's what she does. She audits, she collaborates and communicates with the team, she researches, and then she implements. So once she finds trends that need to be fixed or trends, comorbidities, whatever the data is that she can implement into technology, she then uses her team to come up with different ways to map out or create rules into the system that will alert the team or that will actually sometimes even do the job of collaborating for the team. For instance, allergies. If the admissions officer puts in allergy for the patient to be penicillin, she creates a rule into the electronic healthcare record that any medication ordered by a physician that ends in "-cillin" would alert the pharmacist. So this brings patient safety and quality as well. Currently, she is working, or she just got finished with a project where she implemented a patient portal on Tenet website. So the patient is able to go in real time as physicians sign their orders. She could see their diagnoses. She could see the labs, her lab results, anything that we see in EHR with some limitations, the patient can see in real time as well, which helps them advocate for themselves. So she is affecting not only nurses, but patients. And I just can't emphasize enough how many people she comes in contact with just by doing what she does. And then the second part of her job is education, where when the new grads come in or people need help with the electronic healthcare system or with other technology in the hospital, she's able to teach them, put together teams. Which leads me to my specified question that I had to ask her was, what are you working on now? I know we're in COVID, but this lady does not rest. She has continued research, and she is now implementing Cerner Plus, which I have a privilege of being part of as a super user. So blessed by that. It is an EHR configuration that's more than what we have now. So we're able to go in and do the D part, or the discontinuation of a patient much easier, fewer clicks. We're able to do an assessment as we discharge the patient. So, and then there's many other things that go along with Cerner Plus that I haven't learned about yet, but I'm super excited for what she's about to do and what she's already done with this. Let's see. I asked her about her what she does on her day-to-day, and she explained to me that most of it is long-term goals. So because everything takes such a large amount of time, she's got to collaborate with many different professionals. It takes a longer period of time. So she has a calendar, stays mostly full, and then those shorter term goals are usually the education type goals, going and teaching the new grads. So that was pretty intriguing. As a master's prepared nurse, this interview has impacted me so much. I know my resources. I know that when I go into EHR, how important it is to document precisely, because other people are looking at this to create an even larger impact. It's not just for this patient, which is, it makes me feel better about my time management. And as a master prepared nurse, I know that if I see an opportunity to make things easier for other nurses, that I know who to contact, who can do something about it to make things easier and more proficient for others. Thank you so much for watching, and I hope that this interview review helped you.